Hello, I'm Scott Roloff with IntegerHealth. IntegerHealth is a healthcare analytics company that works with insurers, health systems, and employers across their health plans, wellness programs, and workers' compensation. Conventional healthcare metrics focus on either what a doctor charges or on quality metrics that measure the process, what the doctor did or did not do. Did the doctor follow standard protocols for treating a particular diagnosis? These quality metrics are merely proxies for the only thing that really matters, the patient's outcome. Did the patient get better? And if they did, how much did it cost? And how long did it take? That is what we do. At IntegerHealth, we quantify those outcomes by merging cost and quality into a single, actionable dollar value. Now you may be saying to yourself, so what? This video answers that question. When you quantify healthcare outcomes, you can do things that you could never do before to drive down costs while improving the quality of care, because now you have a single metric that encapsulates everything. You can evaluate and rank things at the diagnosis level based on the outcomes that they achieve. Who's the best primary care doctor for treating diabetes? The best surgeon for knees? The best hospital? Diagnosis by diagnosis. On treatment patterns, are you getting better results sending back patients to chiropractors or physical therapists? You can even rank the case managers helping the high-cost and chronically ill patients and the workers' comp adjusters overseeing the recovery of injured employees. Who's the best case manager or adjuster based on the outcomes that they are getting, both overall and for specific illnesses and injuries? Now again, you may be saying to yourself, so what? Everybody ranks doctors. And you're right, everybody does rank doctors. But you have to ask yourself, what is everybody else using to rank them? They are all using conventional metrics. What did the doctor charge? Did the doctor follow standard protocols? At IntegerHealth, we are the only ones that evaluate doctors and everything else in healthcare based on their outcomes. Healthcare is not a commodity. Two doctors can follow the exact same clinical guidelines and get vastly different results, because one is just better than the other. You can direct and steer care. Here there's a fundamental difference between health plans and workers' compensation. In workers' comp, in 34 states you can direct care in some form or fashion. This can take the form of setting up a provider network that the employee has to stay within, establishing panels from which the employee chooses, or the adjuster even sending the employee to a specific doctor. For the city of Fort Worth, we used outcome analytics to identify the best providers for each type of injury that the city put in a network. And a nationally published case study documented how that decreased the city's cost 23%. Now, you cannot direct care under a health plan, but there's still a lot you can do to get folks to the best doctors, who will cost less overall and get them better care. You can work with the case managers helping the high-cost and chronically ill patients, guiding them to the best doctors for what they need. And this is where most of your money is going to be. You can also work through the provider network, letting the PCPs know who the best specialists and surgeons are to refer their patients to. This is particularly powerful when an employer has on-site clinics that are the first stop for their employees. You can go through the patients themselves, integrating outcome analytics into your health plan's Find a Provider tool. You can optimize plans and networks. Say employees can pick between a PPO and a high-deductible plan. Looking at the claims, you may think that the high-deductible plan is doing great. The outcomes might tell a different story. Because the employees are paying most of their healthcare costs until they reach the high deductible, they may be deferring care, getting sick, and missing work. So at an enterprise level, when figuring in those employee absences, the high deductible plan may be costing a lot more than you think. You can evaluate and compare health systems and insurance carriers based upon the outcomes they're getting, and use that when negotiating contracts. You can sculpt provider networks, including the best doctors in a narrow network or stratified networks, by decreasing copays and deductibles when folks go to the better doctors. If you have HSAs, you can even pay folks to go to the best doctors by contributing to their HSAs when they do so. You can quantify the returns on your wellness programs, including the impact on employee absenteeism. Currently, we are all grappling with how to handle GLP-1 weight loss drugs. For these analytics, those drugs are just like a weight loss program, so we can calculate the return on those GLP-1s too. Knowing the returns, we calculate the program's return on investment, identify employees not in a program who should be, and programs that an employer doesn't have but should. These are just some of the things that you can do when you can quantify healthcare outcomes. If you would like to learn more, here's my contact information.